Good afternoon, everyone. It's so nice to see everyone virtually. Today, we are here to celebrate the funding of a program that will be the first in the nation, so to speak. The California Medicine Scholars Program will ensure that community college students have access to medical school. As a proud daughter of immigrants and a first-generation college graduate, I understand the importance of higher education and what it can do to alleviate poverty. I have seen firsthand how lack of resources and mentorship for students has affected their ability to further their education. That is why I have fought since I was elected to the state Senate to improve pre-medical pathways by creating a pipeline from the California Community College System, the second largest and most diverse education system in the world, to the practice of primary medicine. I did not do this alone, however. I did this with the help and support of all of you. And of course, everyone on this call has been part of this journey. It has not been easy, but here we are celebrating our budget win of $9.975 million allocated in this year's budget. The California Medicine Coalition has been my partner on this, and all I can say is thank you for all your hard work and dedication. I want to give a special thank you to Dr. NX, who was just a wonderful ally and partner in trying to get this done. I appreciate his late night calls, his early morning calls, his weekend calls, and he was always there consistently pushing along my side to help me, working together to make this happen. But I also want to give a special thank you to Dr. Wang and Dr. Chang for being early champions of this program. The California Medicine Scholars Program provides incentives for institutions to work collaboratively to address systemic barriers in policies, practices, and culture that continue to hinder the academic success of underrepresented minority and community college students. It establishes 4 regional hubs of healthcare opportunity, each of which include 3 community colleges, 1 4-year undergraduate institution, 1 medical school, and 3 local community organizations. And one of the regional hubs will be here in the Central Valley. Leveraging the diversity within the state's community college system is key to increasing underrepresented minorities in the field of medicine, while addressing the impending primary care shortage. Latino, African American, Native American, and Pacific Islander physicians are significantly underrepresented across California. In regions such as the Central Valley, the Inland Empire, and the Imperial Valley, communities are already experiencing the pains of provider shortages, lack of network adequacy, and poor timely access to care. Researchers from the University of California, Los Angeles Latino Policy and Politics Initiative reported in 2018 that the scarcity of Latino physicians in California has led to a deficit of 54,655 Latino physicians required to achieve parity with non-Latino white physicians. If existing trends in recruitment and retraining of physicians continue, researchers calculate it will take California 5 centuries to achieve parity. Doctors face an enormous amount of debt when they finish medical school, so it is important that we tap into our community college talent. In addition to bringing more young people into the profession, we must also find ways to keep quality doctors in California. Currently, the California community colleges do not offer a pipeline for students that would facilitate their ability to attend medical school. A college pathway pipeline will help produce physicians who, upon completion of their training, will care for patients in vulnerable and underserved communities. Our nation, along with the rest of the world, is currently still experiencing the devastating effects of the COVID-19 pandemic. By making it easier for underrepresented students to attend medical school, there will be more physicians from backgrounds that will help provide them with an understanding of the way of life in underrepresented and rural communities, which is integral to enable them to prevent or limit the impact of future pandemics and diseases. I believe it is important that we hear from students who are navigating this system and applying to higher education institutions. So I'm happy to introduce Vanessa Neva, who will share her story with us today.
Hi, thank you so much, Senator Hurtado. I am so honored and grateful to be here today. My name is Vanessa Nava. I am a Mexican-American, first generation, born and raised in Sonoma County. I attended Santa Rosa Junior College and so grateful to have been accepted to all the universities I applied to, including UC Berkeley, Cornell, and I ultimately did graduate from UC Berkeley and am currently doing research at Stanford, do mentorship through the nonprofit Deep Talk, and I'm a district representative for the Sonoma County Mental Health Board. Growing up, my parents would always tell me, do well in school so that you can create your own path. And so that's what I did. I focused in school, but also looking back, I realized that I was always late to know about opportunities that my peers already knew about. So I'm really fortunate that at community college, I had teachers who would go out of their way and provide me with opportunities that helped me progress in my own education and help with my resume. But it took me 4 years to get out of community college. And so where I see this program being such a huge impact to students is in it providing counselors who are knowledgeable and know resources that are specific to pre-med students, to not only get them to transfer, but to also have the medical school application in mind and provide that clear pathway for them to get into med school. And as you said, Senator Hurtado, to create the diverse medical workforce that we need out there here for the diverse populations in California and throughout the United States. So I am just so grateful to everyone who has created the California Med Scholars Program and has brought it to fruition. So thank you so much to everyone who put that effort in and make this happen. I'd like to bring this next over to Dr. Enix, who is here, and I'm so grateful to be here with him today.
Thank you, Vanessa. All of us, and I know I can speak for myself for sure, I'm inspired by your words and by your journey. And congratulations and best of luck to you in your future. It is indeed a pleasure to be here alongside Senator Melissa Hurtado. As she pointed out, we've been in contact on this journey, probably more than she would like, but nonetheless, it has been indeed a fun journey. Our organization, the California Medicine Coalition, I am the chair of the organization. And we developed over the past 5 years, the California Medicine Scholars Program. We are indeed thrilled and honored to have been funded through the California State's General Fund to implement a pilot program. The funding amounted to $10.5 million. The program is designed, as the senator pointed out, to produce underrepresented minority physicians, beginning with the California community colleges, and provide them with the proper tools in their journey through medical school and beyond. We're eternally grateful to the Senator Melissa Hurtado, for sponsoring the bill and along with the co-sponsors and the budget request. We're grateful also to the California Future Health Workforce Commission that did such a wonderful job in promoting equity in the California healthcare workforce. You see, the evidence is clear that access to care from a diverse provider healthcare workforce will reduce the burden of disproportionate chronic diseases in the underrepresented minority communities across the state of California and across the nation. Speaking of which, and in addition, we're also enormously grateful to Congresswoman Barbara Lee of the California's 13th District for taking such a keen interest in establishing a federal bill supporting a national pilot program. Much of that will come later, but the program will emulate California Medicine Scholars Program here in California. We're hopeful that once again, the nation will follow the wisdom of California leaders. And again, thank you very much, Senator, for allowing me this opportunity and the opportunity that you have given to our organization, the California Medicine Coalition. Next, it is my honor to introduce Dr. Chang Na. Dr. Na.
Thank you very much, and thank you for inviting me to share my story today. I wanted to share a personal story to illustrate how important this program is. So with my medical group, Kaiser Permanente, every year we do a program called Hippocrates Circle. We partner with a local middle school, and we try to engage with them to encourage them to grow up, to go to medical school and become doctors. The first day of the program, what we do is we do a panel discussion with a group of doctors, and we meet with the parents and students to share our personal journey, where we grew up, what inspired us to become doctors, how we got into medical school, what that journey was like. In one of these occasions, after the panel discussion, a parent came up to us and said, "Hey, thanks for being here. But I was curious, how is it none of you seem to be from this area?" This program is crucial so that children from this community have the opportunity and support to go to medical school so that they can become doctors eventually to care for this community. Thank you again, Senator, for your leadership in the community, which has been phenomenal, and for this wonderful program. And now it is my honor to introduce Councilwoman Esmeralda Hertado.
Thank you, Dr. Na. Hello, everybody. Today is a very important day for all of us as we celebrate the funding of SB 40. Many students like myself who aspire to become doctors one day are now given hope and the tools to accomplish their dreams. Living in the Central Valley, especially in Sanger, a rural community like mine, comes with many disparities. And today, I would like to share my story with you. Growing up, I spent many days laying in a hospital bed with severe pain. I remember long 3 a.m. drives to Valley Children's Hospital with my mother. After years of severe complications and long-term hospitalizations, various specialists finally gathered to provide their individual piece to my health puzzle. And at the age of 11, I was diagnosed with a rare medical condition. This diagnosis changed my life forever. And it was at Valley Children's Hospital where I met my mentor and my hero, Dr. Allshouse. He taught me many things about myself, and most importantly, encouraged me to follow my dreams. I was a senior in high school and remember sharing my desire to attend a 4-year university with him. I told him that I did not necessarily want to attend community college. He laughed and said, "Do you want to hear something? It's a saying we have here in the office." And I said, "Yeah, absolutely." He asked me, "What do you call a doctor that went to community college?" And I said, "I'm not sure." He replied, "A doctor." And then he told me, "It doesn't matter where your journey begins. What matters is that you will still be a doctor." So 6 years ago, I ended up applying to community college, and now I am finally in my last year at Fresno State, where I will be receiving my degree in public health. And my long academic journey has made me rethink medical school, but will forever be a part of who I am. And I do not know what the future has in store for me, but what I do know is that SB 40 will give students the opportunity to become the next doctors of the Central Valley. Thank you, Senator Hurtado. I will now be introducing Rowena Robles, Executive Director of the California Medicine Coalition. Thank you.
Good afternoon, everybody. It is my extreme pleasure to be here today. Thank you again, Senator Hurtado, for championing our cause in terms of increasing the physician pool in California. and from Dr. Enix's announcement, maybe beyond, right, which will be great at the federal level. I will talk a little bit about our actual program, the California Medicine Scholars Program. It is very much a result of wanting to address this disparity, not just in the lack of physicians, but also the lack of physicians and physician care in specific areas throughout the state, right? These areas include rural areas, just like Ms. Hurtado talked about, Sanger, as well as other areas closer to the border, as well as east, sort of the whole eastern corridor throughout the state, right? And so in terms of attempting to address the physician disparities, as well as disparities in terms of cultural and linguistic competency, we would like to implement, we're planning on implementing the California Medicine Scholars Program in 4 regions in the state, one of which will be in the Central Valley. And we will be releasing a request for applications for groups of organizations to apply to become a regional hub of healthcare opportunity, an RHHO. And so we will have, there'll be forthcoming announcements about the release of the RFA, which will be in November. And we hope to have the RHHOs, the regional hubs of healthcare opportunities, up and running by next summer, and our first cohort of students by January 2023. So just an overview, in the first year, we hope to have at least 200 students who become California Medicine Scholars and who embark on this pathway from California community colleges to medical school. In the second year, we'll be scaling up each year. So we'll go from 200 to 400 students. And hopefully in a few years, we'll have more than 4 hubs. We'll increase that to 5 and then 6 hubs and have hubs throughout the state to implement the physician pathway. And I want to emphasize here that these students are coming from California community colleges. And research has been done that shows that when students originate from a California community college and they matriculate to a 4-year university and graduate school, they ultimately come back to work and live in their own communities. And so then that is also part of our hope with the funding for the California Medicine Scholars Program and the launching of these regional hubs. So again, I want to thank Senator Hurtado and her staff, particularly Marisol Ibarra, who's been invaluable in our journey to where we have come to today. Thank you. I believe we are open for questions next.
Yes, so the first question comes from Daniel, and this is directed to Vanessa. Vanessa, where or at what stage would a counselor be the most helpful to the student population?
Yes, thank you, Daniel Pellegrini, for your question. I think it's crucial to, from that first semester at community college to have a student talk with a counselor who will be inspiring and be able to provide that clear path. Just because, as I said, I was in community college for 4 years because I didn't really have that clear path available to me. And it wasn't, I would say, I had a counselor who had been there that first semester to tell me, you can do it. This is what you need to do. This is the path. And I'm going to help you not only through the transferring process, but also, keeping in mind the med school applications. The path, again, would have just been so much more clear. And I would have been inspired from that first session with that counselor. So I think it is from the beginning, as soon as we can, with students interested to go the pre-med route, to get them to see these counselors that this program will be offering to students. I think that's fine, that first moment. Yeah.
Thank you for that, Vanessa. The next question comes from Connie, and she'd like to know what the 4 regional hubs are. And I think that's out for the coalition to answer.
I'll take that question. The regional hubs of healthcare opportunity, we are releasing a request for application. So it is open. The only region that will be guaranteed a hub is the Central Valley, but they will still submit an application for the RFA. So the RFA will be released in November. It's already been written. It's just being reviewed before release. So yes, so we don't know where the 4 hubs will be except for the one in the Central Valley. So 3 are up for grabs. I do want to say one caveat though, because the time frame from grant application to award to implementation is so short, we will really be considering hubs who have already been working together, who may have already some sort of pathway, whether that is specifically pre-med or maybe pre-health, that's already been implemented, right? So that's just the caveat for this first year.
Thank you for that. The next question is kind of a more generalized question for everyone. And it comes from Dawn, who's the pre-health advisor for CSUSM. They'd like to know how people can get involved and what they can do to possibly help the students at the best that they can so that they can reach their goals.
Maybe I can start. The reason that we do the program with middle school students is because it's so important to get people interested early. You know, it seems like a lot to ask middle school students to start thinking about their eventual profession, but going to medical school is an extremely long process. It has to begin early, you know. It doesn't mean that if you came to realization, the inspiration to become a doctor later in life, it's not possible, but it is very, very arduous. And just like going to top colleges have become very competitive, medical school is extremely competitive, more than what majority of people that apply to not get in. So I see Vanessa nodding along. So that's why I think where we could really help students is to, just like Vanessa said, just wonderfully, we need to encourage them early. We need to let them know early that this is a really wonderful profession and that they can do it. But we also need to not just say the words, but do programs like these to let them know they have support, that there are ways to become doctors.
Can I make a comment?
Of course.
Yeah, I just want to make it clear regarding the hubs. It is our ultimate intent to have hubs throughout the state of California and possibly even throughout the nation, but certainly throughout the state of California. We're starting off with 4 hubs in the pilot, but ultimately we want to have a hub representing every medical school in the state. And of course, a hub is represented by a medical school, a 4-year institution, 3 community colleges, and 3 community organizations, such as a hospital or a clinic.
Okay, so next question comes from Mark, and he'd like to know how the Central Valley region is defined, and if it's possible that there could be a lower Central Valley and a separate upper Central Valley region.
Oh, I'll take that question. In the RFA, it asks that applicants to define their region, right? And so we don't have specific definitions on our end of what a region should be. So we're leaving that up to the applicants. Of course, the requirements of the 3 community colleges, the 2 local 4-year universities, and then the medical school sort of help define the region. But in terms of, we're not defining regions for the state through the application.
Thank you for that. And the next question comes from Dawn. How can we apply to be a hub in the San Diego region?
Hi, Dawn. The RFA will be released in November. And so that is the application to become a hub.
Okay, thank you. The next question is from Asha. Is there any opportunity for CBO pipeline programs, to participate in hubs?
Yes, I think that community-based organizations and community health clinics are integral to a hub. So yes, partner with some higher education institutions.
Great. The next question comes from Patricia, and she's from Napa Valley College. She said that community college counselors are not trained to be pre-med advisors. Will there be more pre-med associations established for CCC training in Northern and or Southern California?
I'll take that unequivocally. That has been part, if you heard Vanessa Nava's story, that has been part of the problem in the past. That is the counselors themselves not being adequately trained. So it is part of our mission to assure adequately trained counselors and that they're providing the proper information to provide the students with the tools to pursue medicine.
Thank you for that, Doctor. Both Patty and Sarah would like to know where they can find the RFA and when it will be announced.
Our website is launching next week. It's www.californiamedicine.org, and there's a hyphen between California and medicine.
Thank
and
you.
I will send to the email list when the website launches. I'll send out that announcement next week.
Thank you. Marcella from Stanford would like to know, is the hub model still flexible enough for medical school partnerships within one region?
Hi, Marcella. Is the hub model still flexible enough for medical? Yes, it is. It is.
Thank you.
I think, Michelle, I'll also make an announcement. We will be having 2 webinars about the RFA. So we will be having about 2 to 3 hour webinars. We'll have 2 of them, one in December, where we will review the entire RFA and the process as well.
Thank you for that announcement. The next question comes from Emmy. She'd like to know, are there existing partner groups already formed and working towards becoming hubs?
I don't know if they're working towards becoming a hub. It seems like from the different meetings I've had is that different groups have already been working on pathway programs, and they seem to be just a little bit smaller in scale than what we are envisioning as a regional hub. So those folks are actually looking for more partners.
Right. I think it's also noteworthy to mention that a hub is underway at the University of California, San Diego. And they no doubt are in the process of considering all the factors involved, and they no doubt will apply to become a hub for the program. So I would say that the area that is most advanced would be that area there in San Diego.
Thank you for that information, Dr. Enix. Cassidy would like to know if post-bac programs are eager to support pre-med students on their journey to medicine. Would pre-med post-bac programs be eligible to join the hubs as pathway programs, hoping to diversify our healthcare workforce?
Right. Yeah. So there is an HCOP, a state HCOP program that is indeed underway, and we will look for ways to collaborate with them, and that they will feature post-bac programs. So I would say the answer to your question is unequivocally yes.
Thank you for that. So Mark would like to know regarding the medical students enrolled in the program, must they all be California residents? And can a hub be more than one medical school if there's a formal partnership established?
I would say that the student doesn't have to be a California resident, but the student must emanate from a institution that's here in the state of California. that is a community college or one of the four-year institutions.
Thank you for that. And then there's one more question that we have. Napa Valley College has a robust, strong medical scholars pathway with Kaiser Permanente, Northern California, but they are not established with hubs at this time. Would that make them ineligible to apply in November?
No, that would not make them ineligible. We're quite familiar with that program and they are well on the way.
Thank you for that answer, Dr. Enix.
Okay, I think we have all the questions, and I know if there's still questions that come up as we go, you're more than welcome to reach out to my office and or to anyone that's part of this group of panelists here today that can provide you with more info. And it sounds like there's going to be a webinar next week for those who have additional questions on how to engage, how to, help, of course, because this is, I believe the work has not been done. There's still a lot of work ahead of us. And so I'm so happy and thankful to everyone that sat on this panel here today to celebrate this enormous win for the state of California, for students here and across the state. And I really look forward to working with everyone as we move forward, but we will provide information in the chat to everyone. So if you have any additional questions, please feel free to reach out. Once again, thank you to our panelists, to all those that were part of this effort. And I continue to look forward to working with you as the hubs begin to roll out. Have a good one, everybody.